You know what? In my 20 plus years practicing medicine here in Singapore, I've had countless consultations where older men come in, sit down, and after discussing their blood pressure, their cholesterol, their this and that, they lean in and whisper something like, "Doctor, I need to ask you something private lah." And 9 times out of 10 is about sexual health. Today, I'm going to talk about something that many of you probably think about, but nobody really discusses openly: masturbation after 60. And before you click away thinking this is inappropriate or uncomfortable, let me tell you something. This conversation could literally save your life, improve your mental health, and help you maintain your vitality well into your golden years. I'm Dr. Cheryl Lim, and I've been helping men navigate their health concerns for over 2 decades here in Singapore. And trust me when I say this, what I'm about to share with you is backed by solid medical research, not just talk cock only. Now, I know what some of you are thinking. Yeah, Dr. Cheryl, I'm already in my 60s and 70s, some of you maybe 80s, this kind of thing still relevant, meh? And my answer is absolutely yes. In fact, let me share something with you. Just last month, I had a patient, let's call him Uncle Robert, 82 years old, came to my clinic for his regular checkup. Very healthy man, still does his morning Tai Chi at Bishan Park, still helps out at the market, but he was looking a bit down, so I asked him what's bothering him, and after some gentle probing, he finally opened up. He said his wife passed away 3 years ago, and he's been feeling guilty about still having sexual desires, still practicing self-pleasure. He thought something was wrong with him, that he should have outgrown all this already. Let me tell you right now, loud and clear, there is absolutely nothing wrong with Uncle Robert. There is nothing wrong with any of you who still have these desires and needs. Sexuality doesn't have an expiration date like the yogurt you buy from NTUC Fair Price. It's a natural, healthy part of being human, regardless of your age. And here's the thing that many people don't realize. Masturbation isn't just about sexual satisfaction. It's actually incredibly beneficial for your health, especially as you age. Let me break down the science for you because I'm not just talking based on my opinions or what I think lah. This is proper research published in medical journals conducted by universities and research institutions all over the world. First thing, and this one is particularly important for you men, regular masturbation can actually help prevent erectile dysfunction. Now, I know ED is something many of you worry about or maybe already experiencing. According to a study published in the Journal of Sexual Medicine, that's a top-tier medical journal, okay? Men who maintain regular sexual activity, including masturbation, have better erectile function as they age. Why? Because when you masturbate, you're increasing blood flow to your genital area. Think of it like exercise for your cardiovascular system down there. If you don't use it, the blood vessels can become less responsive, the tissues can lose elasticity. Regular stimulation helps maintain that function. It's like how if you don't walk regularly, your leg muscles will weaken. Same concept, different body part. And for those of you whose wives or partners are experiencing vaginal dryness, yes, female masturbation helps with that too. The increased blood flow and natural lubrication during arousal helps maintain vaginal health. I know some of you might be thinking, but doctor, my wife and I, we don't have sex so often anymore. That's completely normal. The frequency of partnered sex often decreases with age, and that's okay. But self-pleasure can fill that gap and keep everything functioning properly. Second benefit, and this one might surprise you, masturbation is fantastic for your mental health. When you reach orgasm, your body releases a whole cocktail of chemicals, endorphins, oxytocin, dopamine. These are your feel-good hormones. They reduce stress, they reduce anxiety, they improve your mood. I've had so many patients tell me they struggle with mild depression, especially after retirement when there are daily routine changes or after losing a spouse. The American Journal of Men's Health published research showing that masturbation can significantly help with stress management and mood improvement. It's like a natural antidepressant, and best part, no side effects, no need to queue at the pharmacy, completely free some more. Now, here's something that really caught my attention when I was reviewing the research for today's video. Northwestern University conducted a study, big, reputable institution, and they found that men who ejaculate regularly, whether through intercourse or masturbation, have a lower risk of developing prostate cancer. Let me say that again because this is important. Lower risk of prostate cancer. We're talking about one of the most common cancers affecting men, especially as you age. The theory is that regular ejaculation helps flush out potential carcinogens and older cells from the prostate gland. Think of it like cleaning out your drain regularly so it doesn't get clogged. I know that's not the most elegant analogy, but it works lah. Another huge benefit that many of you will appreciate, better sleep. How many of you struggle with insomnia, cannot sleep at night, toss and turn, wake up multiple times? Raise your hands. I bet quite a few of you. Well, there's a study in the Journal of Clinical Sleep Medicine that found a positive correlation between masturbation and sleep quality. After orgasm, your body enters a state of deep relaxation. Your heart rate slows down, your blood pressure drops, your muscles relax. It's like your body's natural sleeping pill. Much better than taking those medications that leave you groggy the next morning. And ladies, I haven't forgotten about you. Although this video is primarily focused on men, let me quickly mention for women, masturbation can help alleviate menstrual cramps and other pain. During orgasm, your body releases chemicals that reduce pain perception and relax muscles. The Clinical Journal of Pain published research showing that sexual activity, including masturbation, can provide temporary relief from menstrual discomfort. So even post-menopause, when you're dealing with other aches and pains, this can be helpful. Now, I want to address something that I know some of you are concerned about because I see it in my clinic all the time. As you age, your body changes. Your hormone levels, testosterone for men, estrogen for women, they decrease. This can lead to reduced libido, reduced sexual function. You might find that you don't get aroused as easily or as strongly as you did when you were younger. This is completely normal. But here's the key. Maintaining sexual activity, including masturbation, can actually help slow down this decline. It's like any other aspect of health. If you want to maintain your muscle strength, you exercise. If you want to maintain your cognitive function, you do puzzles and read. If you want to maintain your sexual function, you stay sexually active. Simple as that. Let me share another case with you. I had a patient, Mr. 68 years old, married for 47 years, very traditional man, you know the type, never really talked about sex openly, even with his wife. He came to me because he was experiencing some erectile difficulties and he was very stressed about it. He thought his sex life was over. So I sat him down and I explained to him what I'm explaining to you now. I told him that he and his wife need to communicate openly about their needs and desires. I suggested they explore different forms of intimacy, not just penetrative sex. And I also told him, and this part made him quite uncomfortable at first, that solo sexual activity was not only okay, but actually beneficial for maintaining his function. He came back 3 months later and I could see the difference in him. He looked more relaxed, happier. He told me that he'd had an honest conversation with his wife for the first time in decades about their sexual needs. They'd explored new ways of being intimate together. And yes, he'd also started masturbating regularly, which he found helped him maintain better function. But more than that, it helped him understand his own body better, what worked for him, what didn't. This self-knowledge then translated into better partnered sex when they did have it. That brings me to an important point. Masturbation isn't just about physical release, it's about self-knowledge and body acceptance. As you age, your body changes. Things might not work exactly the way they used to. You might have gained some weight, lost some hair, developed some wrinkles and spots. It's easy to become disconnected from your body, to stop seeing yourself as a sexual being. But when you take time to explore your own body, to understand what brings you pleasure, you develop a better relationship with yourself. This improves your self-esteem, your confidence, and that confidence shows in all aspects of your life, not just the bedroom.
Now let me address what I know some of you are wondering because I saw the comments on the original video that made me want to create this one. Someone asked, does this mean I should stop completely or just reduce the frequency? Okay, let me be very clear about this. There is no one-size-fits-all answer. Everyone's body is different. Some men in their 80s still have high libido and masturbate daily, like my patient, Uncle Robert, I mentioned earlier. Others might do it once a week, once a month, or even less frequently. What matters is what feels right for your body and doesn't cause you any distress or physical problems. The question you should be asking yourself is not how often should I do this, but rather, am I experiencing any negative effects? If you're masturbating so frequently that it's interfering with your daily life, if you're developing physical soreness or injury, if you're doing it compulsively to avoid dealing with emotional issues, then yes, you might want to reduce or seek help. But if you're doing it occasionally, it feels good, it helps you relax and sleep better, and it's not causing any problems, then carry on lah. There's no magic number, no rule that says men over 60 should only do it X times per week. Listen to your body. Another comment I saw was someone saying, this is all nonsense, you're just trying to make money on YouTube. Look, I understand skepticism. In my 20 years of practice, I've seen plenty of quack remedies and false information floating around. But what I'm sharing with you today isn't my opinion. It's not traditional medicine or old wives' tales. This is peer-reviewed research published in respected medical journals. I'm citing the Journal of Sexual Medicine, the American Journal of Men's Health, Northwestern University Studies, the Journal of Clinical Sleep Medicine. These are legitimate sources. You can look them up yourself
if you don't believe me. I'm sharing this information because in my decades of practice, I've seen too many older men suffering in silence, thinking their sexual health doesn't matter anymore, when in fact it's crucial to their overall well-being. Let me give you some practical tips for maintaining a healthy solo sex life as you age. First, and most important, be gentle with yourself. Your body isn't 20 years old anymore. Don't grip too hard, don't rush, take your time. Use lubrication if needed. I know some of you might feel pesek buying lubricant at the pharmacy, but trust me, the pharmacist has seen it all and doesn't care. Or order online if you prefer privacy. Proper lubrication prevents skin irritation and makes the experience more comfortable. Second, create a comfortable, private environment. Make sure you won't be interrupted or disturbed. Lock the door if you need to. Put on some soft music if that helps you relax. Maybe take a warm shower first. The point is to make it a pleasant, stress-free experience, not something you're rushing through feeling guilty or anxious about. Third, and this is important, if you're experiencing persistent difficulties with arousal or maintaining an erection during masturbation, talk to your doctor. It could be a sign of underlying health issues like cardiovascular problems, diabetes, or hormonal imbalances. These are things that need to be addressed. Don't just assume, oh, I'm old already, normal lah. Sometimes it's not normal, and catching problems early makes a huge difference. Fourth, if you're taking medications, and let's face it, many of you are taking something for blood pressure, cholesterol, diabetes, whatever, be aware that some medications can affect sexual function. Common culprits include certain blood pressure medications, antidepressants, and antihistamines. If you notice changes after starting a new medication, talk to your doctor. Often there are alternatives that don't have the same side effects. Don't just suffer in silence or stop your important medications without consulting a professional. Fifth, stay physically healthy overall. Sexual function is connected to your cardiovascular health, your hormone levels, your general fitness. If you're not already doing so, try to get regular exercise. Even just walking 30 minutes a day makes a difference. Eat a balanced diet. Less processed food, more vegetables, fruits, whole grains. Keep your blood sugar and cholesterol under control. Don't smoke. Limit alcohol. All these things that are good for your heart and overall health are also good for your sexual health. Now, for those of you in relationships, let me talk about communication. This is something many Singaporean couples struggle with, especially the older generation. We weren't raised to talk openly about sex. It was all very hush-hush, something you just did but never discussed. But good communication is absolutely essential for a healthy sex life. And yes, that includes talking about masturbation. If your wife or partner is experiencing lower libido or physical discomfort that makes sex less frequent, it's important to have an open, non-judgmental conversation. Explain that you have needs but you don't want to pressure her. Suggest that solo activity might be a solution for both of you, takes the pressure off her while allowing you to maintain your sexual health. Many couples find this actually improves their relationship because it removes the guilt and obligation around sex. Similarly, explore new forms of intimacy together. Sex doesn't have to mean penetration. There's kissing, touching, massage, mutual masturbation. Some couples find that watching each other masturbate becomes a new form of shared intimacy. It might feel awkward to suggest at first, but you might be surprised at how open your partner is to new ideas. Remember, she's aging too, her body is changing too. She might also be worried about these same things. For those of you who have lost a partner, I want to acknowledge how difficult that is. The loneliness, the grief, the feeling that your sexual life is over because you're alone. But it's not over. You're still a sexual being with needs and desires, and there's no betrayal in acknowledging that. Uncle Robert, my 82-year-old patient I mentioned earlier, he felt so guilty about still having sexual desires 3 years after his wife passed. I told him what I'll tell you. Your wife loved you and would want you to continue living fully and taking care of your needs. Self-pleasure in these circumstances isn't about replacing your partner. It's about self-care and maintaining your health. Let me also briefly address safety. Some of you might have certain health conditions that require extra caution. If you have heart disease, especially if you've had a recent heart attack or severe angina, you should talk to your cardiologist about what level of physical activity is safe for you. Sexual activity, including masturbation, does increase your heart rate and blood pressure temporarily. For most people, this is fine and actually beneficial, but if you have serious cardiovascular issues, it's worth checking. Similarly, if you have severe arthritis or mobility issues, you might need to adjust positions or use aids to make things comfortable. There's no shame in this, it's just being practical about your body's needs.
Another thing I want to mention, mental health, depression, anxiety, and stress all affect sexual function. If you're feeling persistently down, hopeless, or anxious, that's going to impact your libido and your ability to enjoy sexual activity. Don't ignore mental health issues thinking they'll just go away. Talk to a doctor, consider therapy or counseling. In Singapore, there are resources available, chat for mental health support, counseling services at polyclinics, private therapists. Taking care of your mental health is just as important as taking care of your physical health, and it all connects to your sexual well-being. I also want to say something about staying informed and continuing to educate yourself. Attend health talks, read reputable medical information, join support groups if that's helpful for you. There are resources out there. Don't rely on coffee shop gossip or what your friend's cousin's neighbor said. Get information from qualified healthcare providers and established medical sources. Knowledge is power, especially when it comes to your health. Finally, let me address the elephant in the room that some of you might be thinking about. Doctor, all this sounds good, but I'm concerned about addiction or doing it too much. Look, there is such a thing as compulsive sexual behavior, but that's quite rare and usually involves other psychological issues. For the vast majority of you, if you're masturbating because it feels good, helps you relax, and isn't interfering with your daily responsibilities or relationships, you're absolutely fine. Don't create problems where there aren't any. The negative attitudes many of us grew up with about masturbation, that it's sinful, shameful, harmful, these are not based on medical science. They're cultural and religious beliefs, which you are certainly entitled to hold, but don't confuse them with health information. What I'm telling you today is simple. Sexual health matters at every age. Masturbation is a normal, healthy activity that has numerous physical and mental health benefits, especially as you age. It can help maintain your sexual function, reduce stress, improve sleep, possibly even reduce your risk of prostate cancer. There's no specific frequency that's right. Listen to your body and do what feels appropriate for you. Communicate with your partner if you have one. Stay physically and mentally healthy overall, and please don't suffer in silence with sexual health concerns. Talk to your doctor. We're here to help, and trust me, we've heard it all before. I've been practicing medicine in Singapore for over 20 years, and I've learned that the patients who do best are the ones who take an active role in all aspects of their health, including sexual health. Don't let age, embarrassment, or outdated beliefs prevent you from living your fullest life. You deserve to feel good, to have pleasure, to maintain your vitality and well-being. Whether you're 60, 70, 80, or beyond, you're still alive, you're still here, and your health, all aspects of it, still matters. If this video has been helpful to you, please share it with other men who might benefit from hearing this information. Let's break down the stigma and silence around sexual health in older adults. Let's normalize these conversations so that people don't have to whisper their concerns in doctors' offices, so they don't have to feel guilty or ashamed about completely natural aspects of being human. And if you have questions, concerns, or you're experiencing problems with your sexual health, please make an appointment with your doctor. Don't wait, don't be embarrassed, just go. Your health is too important to ignore. Thank you for watching. And remember, aging doesn't mean giving up on pleasure, intimacy, or taking care of yourself. Stay healthy, stay happy, and I'll see you in the next video.